public health problem that will be discussed is depression in the adolescent population of Brisbane. Reports by Beyond Blue suggest that 1 in 4 people aged between 14 and 24 are living with depression. Adolescent depression is a major public health problem because it is often carried over into adulthood and leads to higher rate of alcohol and drug use, social isolation, impaired academic or work performance, and most importantly to note, there is an increased risk of suicide in depressed teenagers. Depression is marked by emotional symptoms such as sadness, irritability, frustration, and lack of confidence. These are only a few of the emotions a person can go through. Although it is not limited to emotional symptoms, but also disrupted thoughts, behaviours, and physical symptoms, depending on the individual. Depression is especially in adolescents needs to be addressed, as it is these far-reaching symptoms and consequences that come with them that make it such a dangerous condition to ignore. To date, depression is one of the most untreated condition in adolescents. Even though there are a variety of methods used for treatment, because depression is underdiagnosed in Australia, only 35% of those who suffer depression access treatment. The most common forms of treatment include either psychological treatment, such as cognitive behaviour therapy or interpersonal therapies, and medical treatments, with a variety of different drugs available to use, and often multiple types of drugs are used at any one time. The target population for this project is adolescents aged between 14 and 24 years old, male and female, in the Brisbane City Council region. This target population was picked because it is known that about half of all mental illnesses appear before the age of 14, and 75% of all conditions occur before the age of 25. Also, because young men are only 13% likely to seek professional help, compared to around 31% of women. In a systematic review conducted in 2015, it was found that when medications are combined with acupuncture, the treatments were significantly more effective than simply using medication alone. Another report also stated that awareness of depression and where to get help in the community also led to an increase of diagnoses and treatment of depression. This led to the proposed project, using acupuncture to treat teenagers with depression, and use this program to bring awareness to not only mental health conditions, but also the use of Chinese medicine acupuncture for these conditions. The project will be helpful for teenagers who perhaps don't feel comfortable going to the doctor, and also for teenagers who have tried other forms of treatment and it hasn't quite worked for them, or if they're using other treatments and want to use acupuncture as an adjunctive therapy. The community project will run twice a month at Brisbane State High School, and as it has the highest amount of enrolment intakes in Brisbane, it will run on every first and third Saturday and have take-home information for attendees if they would like extra information. The project aims to improve the overall percentage of teenagers seeking help for their mental health conditions, and also to increase awareness of the symptoms of depression and how acupuncture can play an important role as an additional treatment for depression in teenagers. To ensure this goal is met, some strategies will be implemented. To start with, the community must be aware the project is happening, and so advertisement notices will be placed around Brisbane State High School and also in schools in surrounding areas. It should also be advertised during school assemblies. Also, different people should be made aware so that they can refer people when they feel necessary. These people include school chaplains, nurses, and other healthcare workers. Also, getting in touch with general medicine practices around the area. Lastly, social media pages can be set up. In this way, days and times can be advertised, and relevant pages can also share the information with their followers. The community program will run as stated above and will offer free 30-minute acupuncture appointments for teenagers suffering from mental health difficulties, and focus mainly on depression. It will be run by qualified practitioners offering acupuncture, moxibustion and electroacupuncture, and also offering diet and lifestyle advice concurrent with traditional Chinese medicine teachings. Simply by running this clinic will enhance the knowledge of the community on acupuncture and teenagers in depression in teenagers. The success will be evaluated by how many likes the social media pages and posts obtain, and also by the surveys returned by the clients who attend the free clinic, which will be filled out at the start, middle, and end of their treatment therapy. If the program is effective and it should obtain funding, it should be implemented across additional schools and more often during the year so that a wider range of people can be reached and helped.